All right, we will get started. Good afternoon. My name is Amanda Stamp, and I'm the Global Education Director here at the World Affairs Council of Washington, D.C. And thank you for joining us for our bi-monthly Global Education webinar series. Today's topic is Understanding the Ebola Crisis. And this event is part of our monthly series for students, teachers, and the general public to gain access to information on timely global issues by having direct access to experts and to ask the questions that you want. If you're interested in learning more about our programs and to receive our weekly updates, please visit our website and join our outreach list at worldaffairsdc.org. After our speaker today, Chad McCordic, finishes his remarks, we will open up for questions, which you can send through the chat function within the system. Please make sure you state your name and where you are from, and we will do our best to answer all of the questions before the end of the program. Today, we are talking about the ongoing Ebola crisis, which is affecting West Africa and has been found in other parts of the world. It is in the news on a daily basis, and our speaker today, Chad McCordic, is going to be talking to us about his firsthand experience and what his organization is doing. He is the Community Projects Manager with One Village Partners, which is an NGO focused on development in Sierra Leone through community, innovation, and local partnerships. He will be sharing some of the cultural factors of the outbreak as well as his personal experiences. And additionally, he also is a contributor to NewsWeek Magazine and has included recent pieces on Sierra Leone and Ebola. So please join me in welcoming Chad. And if you just give me 1 second, I'm going to just a little technology thing. I'm going to pass it over to him. So just bear with me.
All right. Everyone can hear me okay, I'm hoping. Thanks for having me. I've worked with One Village Partners, as you just heard, in Sierra Leone, and I left in early July, or about mid-July, actually, as the outbreak was starting to go out of control. Today, I'd like to talk to you about my experiences in Sierra Leone during the initial stages of the outbreak and some of the reasons why the outbreak spread as fast as it did in West Africa, and why ultimately, after very many months of bad news, I'm beginning to feel optimistic about the fight against Ebola. Right now, I'm coordinating operations with people there on the ground, and I'm on the phone daily with friends and colleagues and coworkers as we move forward our crisis relief programming. But I'd like to start off by telling you a story that I heard on the phone just yesterday. And it takes place in the village of Jokibu. And so if you give me 1 moment where I do a technology thing. Okay. Here you go. So my friend Yusuf, this is an average this is the village of Mamba, but you can see there up on the left on the hill, that's a local clinic. My friend Yusuf was driving past the clinic in Jokibu, and he saw a woman sitting on the bench, waiting to be seen by the nurse inside. When he saw the woman, he saw that she had that particular dead look in her eyes that people are beginning to notice more often in Sierra Leone as the Ebola crisis continues. He asked her what was wrong, and she said she felt very cold. Yusuf stayed a fair distance away, but he called the nurse right away because he recognized that this could be Ebola. The fever, the heavy fatigue, and she was complaining of a strong headache. Yusuf found out that she was from a village a kilometer away, and she had walked in with 2 of her friends. The nurse came out and immediately recognized the symptoms, and they called the ambulance. But because the village is so remote, the ambulance that would come to take her away to treatment was too far away to come that early evening, so they had to wait until tomorrow. So the woman went home, and Yusuf got on the phone to the community health worker that was in her village. And in her village, they immediately quarantined the husband and the 2 kids. By the time she made it home, her health was already failing, but they put her into her bedroom for the night, and as well put her 2 friends who had walked with her in quarantine. After she left, the clinician sprayed down the whole area that she was sitting with chlorine and tried to clean the area as much as possible. And meanwhile, in her village, the authorities and community health workers were trying to track who she had come in contact with, who she might have exposed if she does indeed have Ebola. So I lived in that village of Jokibu, not too far away from where that clinic is, actually. I worked in Sierra Leone in the far east in a very poor and very remote area. The closest city to where I was Kenema, which ended up being the epicenter of the Ebola outbreak, as well as the headquarters for the Ebola response. I first read about the disease far, far before many of you did. I read about it way back in March when I saw a news headline that said a confirmed case of Ebola in Guinea. And I read on, and it turns out that there was an unconfirmed case of Ebola in a village in eastern Sierra Leone. And I thought to myself, wow, that's me. I live in a village in eastern Sierra Leone. This is me fetching water when I was back at my home. So I'm not a health expert, but I've become very familiar with a lot of the basics about this disease. The disease spreads by direct contact with fluids. When someone is sick, and only when they're sick, they are infectious. The chances improve dramatically if you get treatment early enough, but there is no cure. But through treating the symptoms, many people do survive, but here in Sierra Leone, many people do not survive. The death rate is about 70% of people who have a confirmed case of Ebola end up dying. The early signs of the disease are very similar to what that woman had looked like: the fever, the headache, and eventually that would be followed by uncontrollable vomiting. Essentially what happens in Ebola is that your organs begin to be destroyed from the inside out. And most people are dead within a few days. So far, Sierra Leone has had over 3,500 confirmed cases of Ebola, over 1,000 deaths from Ebola, and in all of the West African region that's been most affected by Ebola, there's been 10,000 cases in Guinea, Liberia, and Sierra Leone, and over 5,000 deaths. But the sad part about this is that's probably not the true amount of people who are affected by this disease. There is a lot of underreporting happening, and many people aren't actually making it to the hospital to get tested. So the World Health Organization recently came out with a report that said the death toll from Ebola in West Africa is probably 3 times what is officially being reported. So that would mean that about 15,000 deaths are currently taking place in right now in West Africa. In the early days of the Ebola outbreak, many people just kept going about their business. This is a scene from Kenema during a particularly busy market day. Many people, you know, Sierra Leone is one of the poorest countries in the world, and many of the things that we take for granted, like the knowledge of how diseases spread, how one person can sneeze on you and make you sick, that sort of basic level of knowledge isn't there often, especially in the rural areas. There's many reasons for this, and one of them is the devastating civil war that Sierra Leone experienced for about 10 years in the 90s. That meant an entire generation of people weren't very well educated. The other thing is really Ebola is just one of the many diseases that people have to deal with on a daily basis. I mean, you can tell by this graph here that at the end of the day, Ebola isn't quite as deadly as malaria or even something that people would think would never kill you in the West, like diarrhea. nevertheless, there's also a long-term mistrust of the government and in Sierra Leone. So when you couple this with the fatalism that people have because so many diseases that are difficult to understand are operating around them, they may not have the proper level of education about how diseases are moved from one person to the other. There's also this civil war that really, there was not a single person in Sierra Leone that wasn't affected by the civil war. And when the government started to come out with these messages about Ebola, many people immediately mistrusted them and thought it was an international prank to get more funding from rich countries like US and Canada. Something we should also talk about is the burial practices in this part of the world. Part of burying someone in these communities involves many people laying hands on them, washing the body, preparing it for burial. And in Ebola, the viral load, the amount of the virus that's in your body is the highest as you die. So basically, this was one other way that the disease was spreading. There was a chief's son in a village nearby where we lived who was attending a funeral of someone who had died very, very quickly. And there were some rumors going around that this person had died of Ebola. He said, Ebola is a hoax. I don't believe it. For example, look what I'm going to do. I'm going to touch the body. And then he actively encouraged everyone in that village to come and touch that body as well. And many did. And of course, he ended up dying of the disease and all those who touched him, and Ebola is still a factor in that village now. But there's also a much more simple explanation for this, and that's what would you do if this was happening to your family? You know, it's hard to turn away from someone who's suffering, and in Ebola, you are suffering quite a bit. So as someone would begin to get the symptoms of Ebola, a family member would rush to console them or treat them, and that family member that was treating the Ebola victim would end up becoming infected themselves. This is why many in Sierra Leone are calling Ebola the family disease. Despite all this, Ebola is actually quite hard to spread. You really do need direct contact with a sick person's bodily fluids. It's not airborne. It's not something that, you know, will pass around like the flu. But so everything that I've explained up until this point kind of explains how, you know, these it flared up very localized in certain areas, but it doesn't explain how it ended up traveling so far across two borders and across different countries in Africa and eventually to the U.S. This is a how do I call it, a sensitization van that was driving through the streets of Kenema in the early days, and they would broadcast messages about the virus, how to avoid it, what to do if you saw someone who had the virus. But by this point, the virus was already spreading, and it was spreading much faster than anyone anticipated. Part of the reason for that is that borders are very arbitrary in this part of the world. It's very common for someone to have family in Sierra Leone and Liberia and Guinea. And when we think about borders, it's not like the kind of border that you see between Canada and US, where you have to go through passport control. There's many roads that don't even have police checkpoints on them. So traveling between them is not so difficult. Additionally, the economies in these three countries have grown at enormous rates in the last few years. And it's easier to travel in these countries than it ever has been. I think you can see in these pictures all the motorbikes that are swarming around the van and the different traffic. This is common. By far, motorbikes outnumber cars 3 to 1. It's the easiest, simplest way to get around, and many motorbike taxis travel across the country and into areas that are really, really hard to reach for cars and trucks. This is another way that it could have spread. Oftentimes, you know, when you're far off in the village, you don't have the luxury of waiting for an ambulance to make the half-day trek to get you to a hospital. Many people hire a motorbike driver to take them in. So if someone was sick with Ebola, they would have been sat on that motorbike, and that motorbike would have driven into the city, dropped them off at the hospital. Meanwhile, that motorbike would have stayed in the city and picked up someone else to travel back. So that kind of contamination was happening quite a bit, and this is why in July we stopped taking all forms of public transport, because we didn't know what kind of surfaces could be contaminated, and we had no idea if our driver had potentially picked up someone who was suffering from Ebola. So when I left in the middle of July, there was a lot of the other NGOs who were working in Sierra Leone were really quite afraid, and they all decided it was probably about time to leave unless they were a dedicated aid group like Doctors Without Borders. We all knew it was going to get worse, but we had no idea it was about to get much, much worse. And part of the reason it got so much worse in the last few months is because of fear. Families began hiding their sick because scary men in hazmat suits were picking them up. And though it seemed just like a case of bad malaria, when the relative or the friend was taken into the hospital, they were never coming back. And in fact, they ended up dying there. So regularly, people were hiding, and I've already talked about how mistrustful people were about the government. These people in hazmat suits just made it a lot more scary. Additionally, there were some riots outside of the hospitals as they were demanding to see the relatives. Hospitals were already getting overwhelmed. Doctors and nurses were dying very quickly. There just simply weren't enough healthcare workers to deal with this disease, and there wasn't enough space to take in all those that were sick. Additionally, the government response was uncoordinated from the beginning. For the longest time, they had tried to downplay the fears, but eventually they had to realize that they were in deep trouble. So they did start to make some incredible steps when they declared it an emergency in early August. About a third of the country right now is quarantined. And when I say quarantined, it's not like a quarantine to your house. It means that traffic in and out of this area is very restricted. And they enforced a mandatory lockdown of the entire country for 3 days in mid-September, which went off very peacefully. This basically meant that everyone had to stay at home while a team of a group of volunteers and medical experts like the one you see in front of you right now, there were about 30,000 of them that went door to door, house to house to educate people about Ebola and also to assess if they had any people hiding. And if they did, that's when the people in the hazmat suits would be called, of course. But the other fact is the international community was very slow to react as well. By May, this was already one of the worst Ebola outbreaks of all time, and by June, it was officially the worst outbreak. And since then, of course, things have really gotten worse. I think if you take a look at this slide, I left around July, and now this is only up until about mid-October. So you can see, I mean, how quickly this has escalated to a very, very devastating event. And the other worrying thing about this is the economic and health effects that are going to be worse down the road. School has been suspended indefinitely, so that means seniors who are about to graduate high school and go off into college have had to stall their plans they're probably going to lose at least a year, more likely 2, of schooling in an already very undereducated area. And the other thing that's happening is no one wants to go to the hospital in case they become exposed to Ebola. So people are staying at home when they have very treatable illnesses. There are people who are dying of infections from, like a broken leg that has an open wound or an abscessed tooth. So this is kind of the long-term fallout. And of course, now it's in the USA. And now that it's here, I think it's a good time for all of us to sort of take stock of how we got from a little village in Guinea to a little village in Sierra Leone to mainstream news all the time. I think this proves that the world is more connected than ever before. And especially when it comes, in this globalized world, when it comes to diseases, the best defense is really a good offense. I don't think that we're ever going to be able to keep everyone from West Africa out of America, and that really isn't going to stop the spread of the disease anywhere. We really, it's up to us to really identify health risks around the world in order to keep ourselves safe as well as those who are directly affected by it. I've become kind of an Ebola aficionado. I'm hearing news directly from them on the ground, and I'm also following some disaster risk strategists who very recently put out a blog that was picked up in Wired magazine, and they listed a number of steps of the ways that we can stop this Ebola outbreak, even though we definitely are losing up to this point. So number one, the world's nations need to fill that gap and provide enough money, supplies, and people to outrace the epidemic. And that's beginning to happen, but still it's slow to translate into action on the ground still. We haven't yet seen the benefits of that kind of influx of aid. But also, and I think more importantly, the people of West Africa and the governments of West Africa need to rise to the occasion, radically altering deeply embedded cultural practices from political corruption to the way they bury their dead. And really, this is where I am the most encouraged by this, because we're seeing this happen in the villages where One Village Partners works and continues to do relief efforts. Community health workers are rising to the challenge. They're informing themselves about this disease. And everyone, they are educating their neighbors, and everyone is getting a much deeper understanding of Ebola and how it spreads. People are understanding ways to minimize the exposure, how to isolate the sick, and how to do village-level contact tracing. That is, find out who was exposed to this person while they were sick. And if you think back to the story I told at the beginning, that's a real-life, real-time example of this coming into effect. The world is definitely losing the fight of Ebola unless more resources and a larger effort happens. And that's beginning to happen, but as I said, it's coming slowly. But villagers themselves are learning more and more. While they can't eradicate the disease, they are becoming more resilient on their own to minimize the disaster as much as they can. With some of the new practices and learning that's going on, not only are they protecting themselves, but they're protecting themselves much more quickly before it can spread. The Ebola fight is going to be won in this way, I believe, through that kind of grassroots understanding. But it's also going to take more top-down aid and experts as well. So this morning, the ambulance came to pick up that woman and the others who've had contact with her, her husband, her kids, her friends who walked her to the hospital. They are now under a 21-day quarantine. They're going to find out, they're going to test this woman at the hospital, and they're going to find out if the person has Ebola or not. If the result comes back positive, it's going to be a very frightening 3 weeks for these people as they wait and see if they've become infected. But the perceptive, quick actions of those villagers and the nurse at that clinic means that many have already been saved. This is why I'm hopeful. The people in Sierra Leone are doing their part to minimize the disease, and that clearly is a global problem by now. And now I think it's up to us to make sure that we can help them finish the job. So, thank you.
Thank you very much. That was, I was scribbling down so many notes, I ran out of paper. But while we're waiting for some of the questions to come in, I did have one question for you. Now, I know that you, when you were in Sierra Leone, your work wasn't related to Ebola, but so how has this, you know, outbreak impacted the work of you personally, but your organization, and how have they transitioned into helping on the ground with this, and how do you see that going in the future?
Well, yes, you're right. Like, we're not really set up to do, you know, wide-scale public health relief. What we did do was do community-led development projects, which meant that we were, just a second, I'm going to stop sharing my desktop.
Okay.
Let me figure out how I stop doing that. Yeah, I mean, there we go, stop sharing. Okay.
There you go.
There we go. Really what we were doing, though, was a lot of, what we were doing is community-led development projects, and that meant visiting communities and really integrating ourselves into the local culture, understanding kind of what makes that community tick and what makes, and what are some of the things that they want to attend to, what are the issues that they want to have a development project address in their community. So a lot of this work was very relational, and I think that when the Ebola crisis first happened, we sort of did some informal polls across the villages that we worked, and we found out about 80% of the people didn't believe that Ebola was a danger or a threat to them and their family. So immediately we said, well, we've got to change that. So we deployed some folks to go around spreading awareness messages about Ebola, and about the symptoms and about what to do if you know someone who has Ebola or you see someone who has Ebola. We also put hand washing stations in each village and delivered multi-purpose soap, because something that people don't really realize about this disease is it's quite weak. It doesn't survive, from everything they know about it now, and there's a whole lot they still don't know about Ebola. It doesn't survive that long on surfaces. So really developing better sanitation practices will definitely go a long way to minimizing it. And then along with that, we worked with the local authorities and the clinics in our village to sort of lead by example. And the paramount chief of our area was one of the first big advocates with us. He made rules that people had to wash their hands before they come in. He passed all sorts of minor bylaws to ensure that any individuals who might have been in an exposed area of Ebola, like that, they're isolated very quickly. So yeah, I mean, I think we really kind of, we weren't entirely sure what we were doing, but we knew that we had some strong relationships and that we could leverage this. And in fact, when in the first few weeks, I think around like by end of June, we talked to people in many of the villages after we made that initial delivery, and they said to us, you know, I didn't really believe in all this Ebola hooey, but when I saw the way that you and your company responded, I started to take it more seriously. So I think there's, I think this is the one thing that people aren't maybe as aware of, as how far relationships can go when you're really dealing with this.
Yeah, especially in these smaller villages and communities.
And yeah, and I mean, I think, you know, we can tell by looking at the media here in the States and Canada how fearful everyone is here. Imagine how much more fearful people are who have it right next door. And I think kind of demonstrating solidarity, demonstrating that we're continuing to be there, we're continuing to try to brainstorm with the community health workers in each of the villages about how better these villages can be more resilient in the face of Ebola.
Yeah. Kind of going on what you said here, we have a question here from Mark Sames, who is asking, you had said earlier that a lot of people are distrustful of the government and, of the hazmat suits and things like that. And so do you think that the involvement of other countries, particularly the U.S. and European countries, do you think that our involvement in having people there would help the situation, or would it only increase the local distrust that that people have of the officials in the area?
No, I think it really has to be, like I said earlier, it's really got to be a two-way approach. I think villages are beginning to change their cultural understanding of this disease, and I think also everyone's getting a crash course in epidemics in Sierra Leone. So definitely from the ground up, there needs to be that change in behavior, that deeper education about it. But I think everyone in Sierra Leone would agree with me that there still is a place for top-down technical solutions to this as well. More hospitals, more qualified doctors, more volunteers, more nurses, the whole thing. It's really got to be a both and. And I think as long as those coming into the country are aware of some of these cultural barriers, and they're aware of how much further relationships will get them as opposed to just facts. And yeah, I think even myself, I had friends who right up until the day that I left Sierra Leone refused to believe that Ebola was something that they should be worried about. They're like, well, it's in Central Africa, it's never in West Africa, blah, 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 blah. And I said, look, how about this? How about just because I care about you, how about you go ahead and take it seriously? Just because I'm asking. Not because I'm not asking you to believe everything that's coming out. I'm not saying you have to agree with all that, but seeing how seriously I care about you, won't that affect how you treat the disease? And he said to me that changed things, and definitely for him. So I mean, to go back to your question though, it really in fact we need more attention. I really think that if it's done right, if it's done thoughtfully, in conjunction with the kind of movements that are happening on the ground in Sierra Leone, we really could get a handle on this Ebola crisis real quickly.
Yeah, and just sort of a quick follow-up to that, you're talking about the mistrust of government and top-down and all of this stuff, and do you think that if, going forward, I mean, obviously this has been so prolonged, and you were talking about students missing, 1 to 2 years of education, and these have really deep and heavy impacts on people, not only on the death toll, but on, as you said, on the people who are living day to day in the countries. And do you think that if this gets under control with the help from other countries, that this could be a shift towards, people starting to believe in the government and maybe changing their attitudes as well? I know you said there has to be a lot of cultural change, but do you think that if this gets under control, that would help governments gain some trust from the people?
Yeah, I mean, I don't know if that's going to happen, in terms of the government. I think people are always going to be a little bit I think that's going to take a lot longer, but I really do think this is the silver lining of this crisis, really, and that is people are developing better sanitation habits. People are understanding the communicability of diseases a lot better. I think there was an understanding that, you know, washing your hands at the critical moments is good, and there was understanding that you've got to keep the area around your house clean, and understanding that one person could pass a disease to another. But I really feel as though now people are changing habits quite a bit. People are washing their hands on a daily basis. So there's some good habits that are being formed in this crisis that I don't think are going to go away. Whether this means, you know, in the longer term that governments become more, that people trust governments, I'm not sure. Whether they might trust medical authority, and they might look at medical authority in a much more positive light. So, yeah.
I have a question here. You know, you had mentioned also the burial practices, and also, you know, the fact that people are starting to change their, you know, how they, you know, wash their hands and things like that. Has it impacted the burial practices now? And also, how does that impact, you know, the work that you were doing? I mean, now you've left, but those who are still in the country, and as you were working there during the outbreak, how did that impact your work in the communities?
Yeah, the burial practices, in fact, now it's sort of been outsourced to the experts. So there's a district burial team that whenever someone dies, they are the ones who come and bury the body, whether or not they died of Ebola. It's just a precaution that everyone's taking. How it affected us, I mean, a lot of what we work in small groups, and then we work in large consultations with the whole community. And one of the first things they told us as the Ebola outbreak kind of got running was, you can't gather groups of people together. And that's sort of our entire MO, is like broad democratic community engagement. So that's when we started to shift to this kind of relief and sensitization model. I think we've been talking about this a lot. You know, there are days that I wake up, and I mean, I think it's hardest because I'm contacting people on the ground, and we have a few core staff who are still doing some work, who are connecting with the relevant NGOs and government organizations, and brainstorming with community health workers. So I'm quite involved with them on the phone every day. Right. And there's days that I wake up and I'm like, you know, forget it. I'm just going to go back. I'm sure I'll be fine. And then I think about it, and then I calm down. Realize that I'm not going to be much of a help, just kind of wandering into this. But before we go back working into the villages, and I think because we worked in such a relational and intimate way along these villages, like, it really was up to them to bring forward the volunteers who would lead the development projects. We would just sort of support them alongside and support the projects monetarily and with advice and expertise here and there. But if we are to go back, we're probably going to spend a lot of time doing, I'm not really sure how to, I guess, debriefing around Ebola, and really kind of letting that community tell their own story about how Ebola affected them. I mean, there's one village where we worked where they were in quarantine for the better part of 3 months and had 22 people die. And then there was one village where we had one case and managed to isolate it really quickly and only had one person die. So, I mean, I think each village is going to have its very unique story when this Ebola crisis is over. And I think a lot of our work when we go back will be hearing those stories and helping people process that.
Yeah. It's interesting that you talk about, you know, that there was the 3-day lockdown that, you know, was relatively peaceful, had an opportunity for people, for the health workers to go in and to investigate a little bit further. And these villages that are quarantining people. And I'm just wondering, because we haven't had a great success so far in the U.S. of quarantining people or people following the advice of our medical staff. But what do you think about, how the U.S. and other countries are reacting to Ebola that's found in their countries? And also, what do you think about travel bans? And do you think to these affected areas, and do you think that is good, bad, or will do anything?
I think the U.S. Is doing much better than people think. Well, at least, okay, much better than the mainstream media is making it seem. I mean, if we're looking at this outbreak, many of the people who've been exposed are voluntarily putting themselves into quarantine, even though there's no direct evidence that they've been exposed to someone when sick. The two nurses who picked it up from the Liberian gentleman in Dallas, they're disease-free now, which goes to show, like, a lot of this is due to the kind of care you get and how quickly you get that care. Ebola doesn't need to be a terrible disease that 100% kills each time, and I think we're seeing that. I think hopefully eventually the hysteria is going to calm down a bit, because it's really troubling, the stories we're hearing of, like, kids getting bullied in school because they're African, parents freaking out, and even if someone's traveling to, like, East or South Africa, thousands of miles away, far away from the Ebola crisis, parents are pulling their kids from school or pressuring school administrators to keep that African kid out of school. I mean, there's all sorts of things like this that comes more from a sense of fear than anything. And fear is what spread the Ebola outbreak in West Africa. So the best thing anyone can do is be informed and less fearful, and start calling out the news agencies on their BS. When it comes to travel bans, I think this was, when I was there in Sierra Leone, this was one of the things I was worried about, that eventually, an airline would cancel, or governments would stop letting us in, or there'd just be a massive global freakout. I was clearly a few months off, but the week after I left, British Airways stopped flying to Sierra Leone, and that's one of the main ways people get in and out. I don't think that, like I said, it's not, there's really no way that you can ban people from traveling from Sierra Leone. So, I mean, yeah, there are no direct flights directly to the U.S. from this area of West Africa. You can try to ban people from these countries from entering in through the airports, but I mean, like, the world is really so globalized now that that might actually make things worse. People might flee into another country. A lot of people have dual citizenship because they have families in different countries in Africa. So they might just use their Ghanaian passport or their, Ivorian passport or something like that. Now, I'm not saying this to say, like, oh, Lord, like, this is even scarier than I thought. I'm saying I don't really think it's a conversation we need to be having. Worrying about who comes into the country and who to ban from coming into the country isn't quite as important as getting a handle on this outbreak now. We need airlines traveling to these places to get the health workers, to get the experts there, because without that sort of aid and assistance, like I said, working with the grassroots efforts that are happening, we're not going to get a handle on this Ebola outbreak. And just as a side note, I don't know if this makes all of you feel more uncomfortable or whatever. I'm not worried about whether it's coming to U.S. or Canada. I really feel confident in the healthcare system here and the professionals. I'm more worried about it traveling to a lesser developed country like India, some place that has not quite as developed of an infrastructure. someplace that could make it very densely populated, less infrastructure, it would mean it would spread a lot more easily.
Yeah.
And that would be a whole other thing that we would have a real big difficulty getting a handle on. So.
Definitely. And I mean, as you mentioned, you know, now with our globalized world and everything, you know, our world is smaller, and, you know, as you were saying, people have family and all over the place and dual citizenship and, you know, planes traveling all over the world. But it's been like that for a while now. And why is it now that it's this big? I mean, there's never been an outbreak this drastic.
Yeah. And this was what a lot of people didn't believe in West Africa. But where Ebola had, you know, there's been Ebola around since it was discovered in '76, and the research that comes out is showing that Ebola's zoonosis viruses like Ebola that travel from animal to human, they've been around for millions of years, that research is showing. So, I mean, like, it's been around before. I think the big difference is the population density. Before, they were usually located in isolated, really, really remote villages in Central Africa, in the Congo and in Uganda and things like this. And now it's traveled to West Africa. And West Africa is a completely different kind of beast. It's a lot more densely populated. Even the remote villages are closer to other remote villages.
Right.
So, I mean, it's kind of like a flu epidemic, you know, taking shape in Kansas, and then that same flu epidemic traveling to Manhattan, and people saying, well, why is it the flu epidemic is so much worse now that it's in Manhattan? It's really a lot to do with geography, I think. You know, West Africa, people live in more dense cities, people live closer, it's a smaller geographical region as well, and there's roads, despite how terrible they are, that connect people. So I think what we're really seeing is kind of like a 21st century disease. There's just only recently, especially in West Africa, been the kind of infrastructure that could, you know, support enormous economic progress, but also support the speedy transmission of this disease.
Well, right. I mean, it's so important for people to understand how all of these things are interconnected. You know,
Yeah.
to, you know, as you're talking about education, you know, investment, you know, being able to hold down a job and to grow your economy, and it becomes very important in terms of advancing the country, and also, you know, for people to understand what they need to do to prevent these outbreaks.
Absolutely. And I really think that this becomes a lesson in how we can't judge the advancement or the economic advancement of a country based only on their GDP. Because clearly Sierra Leone's economy was growing by large amounts, and a lot of that was due to new mining and new businesses being set up. But you can have all that economic progress, but if you're not having the healthcare system and the infrastructure move along in step with it, this is the kind of thing that you're going to be seeing.
Yeah. I have one more question here, and I just want to let everyone know we have a few minutes left. So if you have any last-minute questions, make sure you get them into me so I can ask them. But I have a question here. So, you know, you're talking about before the ease of travel between many of these countries, and also the fact that, you know, we need outside help to come in and help these countries to provide the infrastructure and things like that. But have you seen any cooperation among the regional powers to be able to take control of this and with the message and also changing the culture and, you know, informing and educating people and things like that?
For sure. Actually, a number of the professionals who've been brought in, who've been working with the World Health Organization and MSF and have died, have been nationals from other countries in Africa. There was a Sudanese gentleman, a Senegalese man. Now, I don't think there's been quite that level of cooperation. I think because a lot of those countries are worried about an outbreak potentially happening there. Now, for example, Nigeria had an outbreak and they were able to contain it, and I think that also means that Nigeria is definitely in a different tier in terms of African countries, in terms of economics and in terms of healthcare system. But we really, I think it's, there's a lot of fatigue of people thinking, why does U.S. and the West have to be the ones to lead these kinds of things? But there's actually like a number of countries around the world who are involved in this fight in really crucial ways. China has been donating quite a bit of money, building hospitals as well. And Cuba has sent over 100 doctors to this area. And like, we're talking trained, qualified doctors are being sent to this area. And that's what all the experts are saying they need more than anything. Like they need people. They need the experts who know how to treat Ebola patients, who know how to keep them, who work with dangerous diseases, and they also need the people on the ground to adapt, to change the cultural tone around diseases as well. So, yeah, I mean, we might be seeing more response from other countries, and I mean, there has been, it's been minimal, but I'm hoping to see more in the future. I think it'd be really great if Nigerian officials were sharing a lot of their best practices. Like, this is how we got a hold of our Ebola outbreak, and we minimized it only down to 20 deaths. You can do it too. Here's what we did. I think as this crisis goes on, we're going to see more of that, for sure.
Yeah. I have a question here. I'm going to tie a couple things in together, but, you're talking about, before media and their impact on the story of this outbreak and the good, the bad, and the ugly, but there is a huge part that they play in informing the public, but also, since we live in these, attention cycles where, whatever's hot at that moment, it's on, but do you think that, how is the media going to have a negative or a positive impact, and, and the fear of sort of pushing Ebola out of the news, or also using that as a way to not talk about some of the other major things that are going on?
Yeah.
And then I'm going to follow that up with, as individuals, because of, and relating that to media, but what can we do, both to stop the misperception of, as you were mentioning with Africans, but particularly West Africans in this country, around the world, and our knowledge of the outbreak and things that we can do. I know I just threw a lot at you. Sorry.
Yeah. Yeah, it's a big question, but it's one that I thought of before. The other day I was thinking about how in the early days of this outbreak, I was practically begging, like I just wanted CNN to do a piece on it, like back in May or June. I was like, this is a really big deal. Why don't, this could really this is affecting the entire world. I kind of wish more people would pay attention. And then just, a couple of weeks ago, I was like, boy, I wish CNN would shut up about Ebola. I think, in terms of their role, like they've got some bottom lines to fill and everything like that, and we can't expect them to be the best thing to all people at all times. I just worry about the hysteria that they're peddling, and I've seen how hysteria being peddled in Sierra Leone during the Ebola outbreak caused an enormous amount of damage and really set the country back by several months in their Ebola fight. And I think we're beginning to see the consequences of that with these Casey Hilcox, this nurse who came in from Sierra Leone after working with MSF and didn't have any symptoms, wasn't sick at all, and she was kind of immediately thrown into a quarantine. So, I mean, that shows that there's a balance between taking precautions and letting your fears dictate how you do your job. And I think we all have fears about this thing, and it's good to keep them in check, I think. In terms of what each of us can do, I think, getting better information about this outbreak, informing your friends. There's lots of really good journalists who are on the ground in Liberia especially, who are producing some really, really fascinating work, not just about, this is how bad Ebola is, but how is Ebola affecting everyone's day-to-day life. And I think the more we can kind of inform ourselves about what's happening there on the ground, I think the better. And, Doctors Without Borders has been a really big deal in terms of being on the front lines for so long. And they've really made a huge difference, I think, in terms of what they're doing. So I suggest helping them any way you can. And I'll just throw up some of our information here real quick, just so you get a view. Oh boy. Now I have to go through all of them, but I'll jump right to the end. And yeah, that's our website, and you can follow me on Twitter. I'm obsessed with Ebola updates regularly. But I'm not very good at Twitter, so I should put that disclaimer out there. We're right now working to find other Sierra Leone-led organizations who are doing some really interesting work, particularly around some of the long-term health effects, and the things like the orphans the children who are being orphaned and being stigmatized and cast out of their village. So we're really brainstorming different ways that we can make a difference here. So yeah. I think, I don't know if that fully answers all of that question entirely, but I think the essence is there's a lot of information out there, and we can all make ourselves better informed about it. So we can stop the fear right where it starts.
Yeah. Absolutely. Well, thank you so much for taking time out. I want to just mention real quick to everyone that this will be available on our YouTube channel after this recording. So if anyone would like to see it again or to share it with anybody else, we encourage you to do so. And again, we want to thank you, Chad, for taking time out and some really important information. And I guess before you leave, I just want to ask real quick, well, maybe not so quick, but what do you see happening in the next 6 months to 1 year? With
I've been thinking about that regularly.
Yeah, I can imagine.
Since I've come back. Originally, when we left, we thought things would be under control by end of September. Now we're looking at maybe going back in early part of the year. I think the big thing for us is waiting for the number of cases to stop rising, like they've been. And I think once we start to see some slowing down, as the number of cases start to drop, we're going to try to be right back in there. Like I said, working with communities to process what's happened to them after Ebola and kind of start to get back to work as quickly as we can. So that could be early this year, that could be March. I really do think we're at a turning point in this Ebola crisis. I think all the efforts that people are putting in Sierra Leone and around the world, we're really we're going to start to see a difference sooner than later.
Well, I certainly hope so. I know we all do, and we hope that you're able to get back to your work there and continue all of the wonderful things that you're doing. And yeah, again, thank you very much.
All right, thank you.
Thank you.
Thanks very much, guys. Bye-bye.